Hello Westford, my name is Ben Domaingue, Managing Editor here with WestfordCAT, and I'm joined today by Community Wellness Coordinator Nicole Laviolette to talk about Westford's behavioral health resources. Thank you for joining us, Nicole.
Thank you, Ben. So I'm here to share some information about the community wellness in Westford, the resources that are available to all residents. The community wellness coordinator position came through from the Town School and Safety Task Force with a need for more support and resources for Westford residents around mental health and substance use disorder. Since joining the town of Westford, we've also incorporated some parenting resources as well. So I am available for all residents, just a phone call away, to connect if you need supports in researching and trying to figure out what's appropriate around your mental health and supports and what's available also for substance use disorder and parenting supports. So I'm going to just share as far as a few available resources and support for Westford residents. The parenting supports we have available in town with the health in collaboration with the health department. We have a parent support group that is the second Thursday of every month. We typically meet at the J.V. Fletcher Library. Next month will be virtual, and sometimes we're in a town hall, but that information is on the town website. Again, it's the second Thursday of every month from 7 to 8:30. If you're a parent that's experiencing the challenge of parenting a child who may be struggling with their mental illness, their mental health, this is a great support for you. It's an opportunity to meet other parents, learn skills, and have the support from myself, a few residents, and Brittany Nash from the health department. We also have a new parent support group that will be our second time on January 25th at the J.V. Fletcher Library. Two opportunities, a 10 a.m. session and a 4 p.m. session to meet new parents, get some support, some information and resources. We'll be at the meeting room, basement level room. For any questions, feel free to contact me. For mental health supports, the town identified a need a couple years ago for supporting residents with these really long mental health wait lists that we have. So with that, the town, through ARPA funds, supported this Westford Mobile Clinician. So the Westford Mobile Clinician is available on a short-term basis, about 4 to 6 sessions, to support residents while they're waiting for longer-term mental health supports. Unfortunately, the wait lists for mental health counseling can be quite long in our area, so this can be a support while people are waiting. It's for any resident over the age of 4 who can utilize this support. You can call myself or Alice and Christopher at the COA to get that started to see if this is a right fit for you. The sessions are free. We don't bill insurance, and they're typically about every other week to elongate the support while you're waiting for mental health supports. In addition to that, as of December 1st of 2023, the town dissolved their contract with the William James Interface Referral Service, which was a resource and a support for the town for several years. And the reason that the town did this is the cost of that service was going up for an immense amount of money. And the town is part of this resource that the state developed called the Behavioral Health Helpline. So former Governor Baker developed the Behavioral Health Roadmap, identifying a need in Massachusetts for more behavioral health supports. And through that, the Behavioral Health Helpline really was launched in January to support any resident in Massachusetts. It's a free service, and it is very comparable to the interface service. Residents can call the number and in a supportive way talk to someone for mental health support, substance use, and really see what's available. If you have questions, you're more than welcome to call me and we can kind of go through that together. With that behavioral health roadmap that the state initiated, we have some mobile, I might say we, it's for any resident, but for Westford, there's this agency called VinFen. So VinFen has a few different locations, but for us it's Lowell, and so that resource can provide mobile crisis stabilization, ongoing outpatient services, and also community crisis stabilization. Their website, it's VinFen, has a great immense amount of information, but also we can kind of walk you through what that looks like. In addition to those supports, the town select board also approved a new committee last year. I believe it was last year, 2023, which is the Community Behavioral and Mental Health Committee. So with that committee, we actually have 21 as of today committee members, which is between residents and town employees. So there is a great group of people that are discussing what's available, the needs of our community, and how do we move forward with supporting residents. That committee meets the fourth Monday of every month at the town hall meeting room, but it's also hybrid. And you can always find that information on the town meeting schedule as far as where we will be. We do have a website on the town webpage which gives you all the minutes and the things that we have discussed. We're really kind of charged with looking at what the needs are of the community through the different data sources that we have, through the local hospitals, the local alliances, any surveys that the town does, any community input or resources and sharing that we receive, to kind of see really where the Westford community is going and what needs are there, or what needs need to be met. So we've done this through a lot of data analysis. A lot of our meetings this past year have been focused on really looking at data as far back as like 2019 to see what we already have before moving forward. So it's an open meeting, so the public is welcome to attend if they'd like. It is hybrid, and you can always find that information on the town website. So another piece that we have is around substance use supports. So the substance use supports come from all different departments in town. And I'd actually like to start with two resources that the health department has. So the health department is on the second floor of the town hall, and from 8 to 4. And they are available to provide two great resources that are being funded through the opioid settlement funds, which are naloxone kits. Some people know them as Narcan kits, and the Narcan opioid overdose rescue kit. So I'll start with maybe this little one. So these are individual use kits. They're for any resident in Westford. They can get these kits through the health department and get a quick one-to-one training on how this naloxone kit is used. So the kits inside have the naloxone, which some people know as Narcan, and then it has information in here as far as the step-by-step use of the naloxone. It also has a little pair of gloves. Narcan always comes in 2 sets because sometimes you need to administer it twice, but all that information has gone over. You're not provided this without a training, so you do know how to administer this, and it's for any resident in Westford. So you can go to the health department to obtain that. It's a very convenient little kit, and then you can share the information with your neighbors or friends so that they can also have these. The idea is to really have it widespread in Westford just in case, so that it's available and for those to be trained too.
And these are free to take, correct?
Yes, yeah. So these are paid through a grant, and then also through the opioid overdose rescue kits are paid through the funds that the town receives through the opioid settlement funds. So the opioid settlement funds are an initiative through various lawsuits, and what ended up happening was Massachusetts was given this amount of money, and then essentially per demographics, Westford received a certain amount. And we're actually going to be getting this for about like the next 8 to 15 years, these settlements. So there's a working group of staff to kind of look at really that data and what happens within Westford and how is the best use of this funds. And one of those uses is what Ben's holding here is the opioid overdose rescue kit, which is available for Westford businesses. So these boxes can be put up on walls within businesses so that those businesses have the resource just in case it is ever needed for a patron. So the rescue kits can be obtained through the health department. So if you are a Westford business owner and you would like to have one of these kits, you would either go to the health department or call the health department to obtain this kit. And with the kit, there is also a training that is involved. So you're never provided with a resource or a tool and not know how to administer it. So if you do have any questions, please contact the health department. The health department phone number is 978-692-5509. And as Ben has here, there's resources, contact information on how to administer it. I do believe there is some form of expiration date with these types of products, so there is a monitoring of that, and then the supplies can be given through the health department. So for this resource, though, you can also be a business, though, and still obtain these small naloxone kits if that's something you would like to have readily available at your business. Does that kind of feel like I detailed enough information, or what do you think?
Yeah, I think that's plenty. And these have, they both have 2 doses of naloxone. It looks like there's another thing in here, a little orange thing. I'm not exactly sure what this is. Do you know what that is?
I'm not entirely. I'm not entirely sure. But what is good about this piece is the health department does do a very thorough training on how to administer what is available, being mindful of the expiration dates so that you do have to have that information. They'll go over if somebody is having an overdose. How do you handle that? What are the steps that you do so that you are trained and aware of what to do if that does occur. As a side note, these are in all town public buildings, so any municipal building does have these rescue kits in the buildings, as well as the public schools also have them as well. And in addition to that, some of the buildings have this in addition. Those are typically one per building, and then these are additional so that staff have these available, as well as the the town cruisers and the fire trucks and the ambulances. So effectively, everybody in town has them in public safety and all that. Yeah, so the idea was to have it widespread. I think it's a preventative, in a sense, it's a preventative measure so that the resource is there just in case. So you may never use this. You might be a resident that picks this up at the health department and it expires and you have to toss it. Or you may have to use it. But it is there so that you have that resource. Every family dynamic is a little different. There may be somebody in your life that you know this is a potential that they're having a challenge and we may need to have this. So let's have this in our home as a resource, or maybe this is something the town is offering. Let me have this just in case. But it is readily available for residents. And we did put a wonderful amount of money towards these kits through the opioid settlement, and it is something that we're going to continue to fund in the upcoming years as well, so that we have them for, there's quite a few businesses in Westford, so that we have them for the businesses that would like them. Sure, absolutely. I can say that WestfordCAT was contacted by the health department and we will be installing one quite soon. My understanding is there have been quite a few other businesses that have reached out to the health department for them. I'm not sure if they're installed yet, but there seems to be quite a bit of public interest for them to have them in public spaces. Yeah, and it's doesn't matter the size of your business. You know, it could be a small business, a large business, but they're available for any, you know, Westford business. And if you're just kind of curious, not sure if this is something that you're really understanding, the health department can answer any of your questions. So, you know, feel free to call them. if you get for some reason a voicemail, leave a message, they'll give you a call back. They'll do the training right then and there at the health department when you pick them up, so that you do feel comfortable with the resource that you are getting.
Absolutely, absolutely. Put that down there.
And so another piece I was going to share is a little bit more about, I mentioned the opioid settlement funds. So we started getting the settlement funds 2022, I believe, but we really started utilizing those funds within the last year. So really trying to do a deep dive in what's been occurring within the community, looking at the data and statistics, speaking with residents, trying to get some feedback of how we could best utilize the funds. So there is a small working group of staff that have kind of put together some various ideas, and I was just going to share a little bit about those funds. A point of interest may be that we've roughly received about $130,000 in funds. It's really kind of based on your demographics population-wise as far as the different communities and how much you get. So every town in Massachusetts had the opportunity to sign into the settlement, and Westford chose to do that, and that's how we were able to receive those funds. So some of the other, in addition to the opioid rescue kit, some of the other ways we've kind of put the funds to great use is we will be getting new medication in sharps containers. So if you've ever been to the police department, when you walk in kind of through either entrance, there is a medication sharps disposal. So we will be getting new ones of those there. And the health department has been creating new signage and new materials to support residents in understanding the importance of disposing properly medication in your sharps. There are, myself and Brittany Nash are certified for youth mental health first aid. Brittany and a partner provide that, and then Brittany and I provide the adult mental health first aid training. And actually that was one of the points that the settlement funds was one of the key areas to utilize these funds. So we do offer those free of charge for residents because we utilize the opioid settlement funds. There are various trainings that happen throughout the community, and those information not only do we put on the WestfordCAT's calendar, but we also have in various locations through our websites and such. So we'll continue to do those throughout the year as well. We did have a group that we tried to do at the library called the Young Persons Addictions Anonymous group. There's an agency called Family Continuity, and they had a person, really like a peer specialist, that was able to provide this great group. Maybe it wasn't working very well for our community. The numbers were a little bit lower than we would have liked, as in we didn't really have attendance. So we're working on how to best support our youth and the collaboration and support through conversations with the schools and with youth and the different agencies to see where to kind of, but that was one of the areas we were funding. The Neshoba Technical High School and Westford Academy needed some curriculum to support their health classes around mental health and substance use. So that was a piece that the funds went to, was around curriculum. And then another piece is the different schools do speakers throughout the year, and one of the speaking engagements, Neshoba Tech has already had theirs. Westford Academy will be having theirs coming up. I believe you can find their information on the website. It's Chris and Kathy Sullivan. They provide a speaking engagement around the substance use and how to prevent it, really. So Westford Academy will be having theirs coming up. So that's something we've invested in so that they can offer this to the students and to residents. So we'll be continuing with that in the upcoming fiscal years as well. And then another resource, and this is kind of my last resource talking point with the opioid settlement funds, is around this amazing resource that the Westford Academy guidance department was able to find called Cartwheel. I had never heard of this before, besides an actual cartwheel, right? But this Cartwheel service is an amazing support for students. It's a mental health counseling support, but also a collaboration with the guidance counselors around training and assessments. residents. They can actually see the students at school. Usually it's telehealth. They're available 8 to 8, so not necessarily during the school day, but it's a referral right away. So that counseling wait list is kind of mitigated where you are able to see right through Cartwheel. So right now it's a resource for Neshoba Technical High School students and Westford Academy High School students. So those two schools have the opportunity through their guidance counselors. It's really a collaboration and a conversation for that resource and support. But the opioid settlement funds are paying for that for this school year.
And from my understanding, just as a point of clarity, I believe, from my understanding, the resource for Neshoba Tech students, it's only for students that live in Westford, not, all students. It's just the Westford attendees.
So the funding for, so with each, so thank you for that clarification. So that resource, we've really focused because the town is the one that received the funds. So with that, we get about, I think there's about 77 Westford students that attend Neshoba Technical High School. That I might be a little wrong on the numbers. It might be a little more, it might be a little less. So we did bring Neshoba Tech into the conversations to see, how could we kind of support those students that do attend the school. Looking to see, is there things we could do in the middle schools, in the elementary schools. But a piece is that we're really kind of hoping to get, or we are hoping to get feedback from residents. To see, do you have somebody in your life? Have you been touched by substance use disorder yourself or a family member? And what do you kind of see as a support that maybe we could kind of explore for Westford? Some things, there is limited funding. I did say that big number in the beginning. We are going to get about between 25 and 28,000 for the next upcoming years. So, what are some ideas? What things do residents have as suggestions? You're welcome to call me or email me if you do have those ideas.
Absolutely. And I'd be curious, you had mentioned, the new committee that had been formed in, I believe it was 22, at some point late 22. With this extra funding, again, correct me if I'm wrong, my understanding is there's about $5,000–6,000 left of the initial settlement. I think most of it's been allocated at this point. Most
of the funding from the initial has been allocated. Those cartwheel services were quite a bit of money. So those two services through the two schools really kind of was a bulk, and we made that decision to best meet the needs of the students. So, they go hand in hand, mental health and substance use, so to kind of support those two. So that piece I said about the 25 and the 28,000 is really what we're kind of looking at as far as those continuous years. So they might be smaller avenues, so through the schools it might be additional curriculum, or is it the town residents feel like we could get some supports through a speaking engagement, or it could run the gamut, connecting with other towns we've done to kind of see how they're supporting residents, so like towns in our area, to see how they've rolled out the resources and the supports is something that we've done as well.
Sure, absolutely. I was going to get to that, asking just sort of what the committee has found, and sort of are there other ideas that are being floated around for, I guess, direct action to help residents? I guess something like the mobile clinician or anything like that, curriculum, that's all direct action to educate, help residents. Have there been any other ideas floated that could be coming down the pipeline in the next 6 to 12 months?
So one of the things that we've been conversing about really has been with Westford Academy and around, so this is kind of direct too as far as that piece, but that direct support around, could we utilize maybe with some education in the health classes, or also could there be somebody available to speak with students? Substance use disorder, is something that having those one-on-one conversations maybe with a peer specialist may make a student feel more comfortable about talking about their challenges. So could that be something, that could be integrated into Westford Academy? Maybe that's an idea, so that's ideally Cartwheel is a big piece. It's just has a big number attached to it, so that one's a little harder to maintain. I know the schools would love to continue that service through the opioid settlement funds. It's unfortunately the numbers just don't match up at this time, but it is still something that, you know, the schools are exploring to try to, you know, continue. And these are ideas that we've really kind of come up with, so that's the piece that we would really like to hear. And we have talked to residents, and we have had feedback from residents, and we would love to hear from other residents to see, you know, what pieces maybe they've experienced or a loved one's experienced, and maybe they have some ideas for supports that maybe we could kind of explore.
No, absolutely. We'll be sure to publish any survey that comes out, and we'll be sure to promote that as much as we can, so residents can give their opinions as to, you know, how they can best meet their needs, I guess, because you know, they're the ones dictating this. But yeah, we covered quite a bit. I'd be curious, do you have any other things to add? We have quite a bit. We'll be sure to put all of these numbers and all this information in the video description for your pleasure. But are there any other little things that you might want to add?
Oh, I thought of one more thing.
Sure.
So the WestfordCAT has a great calendar. So what's wonderful is I'm able to utilize that to put our information as another way to kind of share with residents what's available. So I actually got this great idea from Ben. I do have open hours at the library the second and fourth Tuesday of the month. I do from 2 to 4. Typically it's in the Mary Atwood room. Sometimes I'm right in that, when you walk up the front stairs, they have that fireplace area over to the left. Sometimes I'm there. It really is open hours if any residents would like to come and just kind of explore resources. Some residents come with direct questions around, this is what my insurance is, what's available for me for counseling in our area, whereas others, it's just an exploration of, this is what's going on, how can I, you know, get some help. And so a great thing too is I might not necessarily be the one to be able to support you, but I can connect you with the person. We have an amazing town social worker in town, Allison Christopher, and she is a great support for residents. So sometimes those conversations turn into a connection with Allison, so she can support you in your journey with wherever you are as far as needing those supports. Absolutely, absolutely. We have a wonderful health staff here in Westford. We have Nicole. We do have Allison. We also have all the folks such as Ray and Gail at the health department. We also have Nancy Burns as well with the Merrimack Valley Medical Reserve Corps. So we have a wonderful staff with plenty of resources for folks to take advantage of, for those who may be in need, who may be struggling with mental health, substance use, behavioral health, or any sort of issue they might be having in their household, at home, at work, anything of the sort. But I think that that pretty much covers everything we wanted to cover. So Nicole, thank you very much for coming on. Thank you for having me, Ben.